Are you struggling in interpersonal skill? Relating to others is a domain that many IMGs struggle. In this video, I'm going to show you common mistakes to avoid and how to boost your score in relating to others. If you're new here, hi, my name is Dr. Erwin Kwun. I'm on a mission to help doctors lead a fulfilling life, and I help GP trainees pass their SCA exam. Let's get right into the video. The first common mistake that trainees make is poor listening. Sometimes under exam condition, trainees might ask questions, but not actively listening to what the patient is telling them, and then they might ask repetitive question, or they might miss a cue that the patient drops. So if you're not actively listening to the patient, you're not picking up on these cues, then you're going to miss pieces in the consultation, or you might ask a repetitive question because you didn't register what the patient said. To make sure that you actively listen to the patient, it's important that you practice it in your clinic. Good way of actively listening is when you're consulting, try and think about what exact words the patient used in the first line when they spoke to you, and try and write it down at the end of your consultation. If you do that, then you're going to have to pay more attention, because you know at the end of the consultation, you're going to write down the line that patient said when they first started speaking to you. So by doing that, you're training your brain to be more attentive and actively listening to the patient. When it comes to cues, it's important that you understand what cues patient might drop. For example, patient might tell you, well, doctor, I hope I'm not wasting your time. My wife asked me to book this appointment. So by saying that, the patient's already dropped a cue that you can infer from that the patient's wife might be worried. So it might be a good idea to explore what the patient's wife ideas, concern, expectation, as well as that of the patient. Sometimes patient might have cues that are nonverbal. So it could be the facial expression. They may be more hesitant when they're talking about something. So if you pick up on these cues, it's important that you're more curious and ask more. So you might have a patient who tells you, I read this thing online and I was going to ask you about this because I wanted to know more about it. So you might want to ask the patient, could I check what is it that you read? So then you can understand more about what they read, and because that could be why they might have these thoughts about this. When it comes to exploring ideas, concern, expectation, commonly GP trainees are very formulaic in their approach. So they do it as if they're going through a checklist: idea, concern, expectation. And if you're asking the ideas, concern, expectation in that manner, then you're not going to show good interpersonal skills. So a good way of exploring the patient's health agenda is uncovering it naturally. So it's important that you have a discussion, as in a dialogue with a patient, as opposed to an interrogation where you're just asking the next question. Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. For example, if you ask a patient, was anything you were worried about? Then the patient tells you, I'm worried about this lump, that it could be breast cancer. Then if you ask the next question, anything else you're worried? It doesn't show good interpersonal skill, because you have not picked up on that cue that the patient mentioned, and this is quite obvious that they're worried about the lump. So good way of responding to that is to ask a follow-up question based on the answer that you were given. So that's why it's so important to actively listen as opposed to go to the next question. So if then you say to the patient, sounds like this lump has worried you. So can you tell me how did you first notice this? See, like you're asking a follow-up question based on the cue rather than asking a question that you've already planned based on your checklist. So making sure that you uncovering the idea, concern, expectation naturally is really important. So don't ask these questions out of context or just have a rigid way of consulting. You have to let the consultation flow, and if the patient has dropped a cue, then be curious and ask the follow-up question. Another mistake is not exploring the patient's psychosocial situation and occupation. in the SCA exam, there is a lot of things that could be affecting a patient's management. For example, if you got a patient who is planning to go abroad this afternoon, and you want the patient to have some investigation and a referral, the patient is not going to agree with that if you don't really take that into account. So it's important that you adjust your management plan based on the patient's circumstance. And it's usually a unique circumstance for each patient. Look at what's the patient's preferences. For example, if you got a patient with weight loss, and you're worried about cancer and you would like to refer the patient under a 2-week wait, but the patient has got a holiday plan for their 25th anniversary, it's going to be difficult to change their plan. And this is where negotiation is important. So listening actively to the patient, showing that you understand their situation, and explaining the dilemma that you've got is really key, so that then you can offer an alternative option, as in how you can help this patient, and explain about the consequences as well if they don't attend an appointment and have investigation. This could delay their treatment. So taking into account the patient's circumstance is critical. Otherwise, it's going to be very difficult for you to score well in the relating to others domain, and also it's going to affect your management plan. To somebody who is going to prepare and sit the exam soon, maybe they were not successful, what's the last piece of advice would you give them, Gordon?
Having that structure, and I guess the coaching from Erwin, that is definitely most important, I would say. Highly recommended.
Okay, so what's the reason you think that the coaching helped you? Like, in what way do you think it benefited you?
Yeah, that's a good question. It took me some time to think about actually how did your coaching or how did your teaching help. And I guess when the first time we had scheduled the first session, you kind of gave hints and you kind of gave pointers, and you also stopped me when things wasn't going correctly, whether that's me missing certain aspect of, let's say, have you considered about their driving, where they need to disclose to DVLA, or actually why don't we replay the last sentence, how we can integrate that into their management. And it's about intervening at the right time at the right place, so that you have an understanding of what you can do going down a different pathway. Some of you guys might be attending different courses, some might be deanery run, and they would have the same actor as well as the ones that might be the MRCGP organized, and there were examiners which are overseeing. You get feedback at the end, but by the time you get that feedback, it might be a little bit too late, because that feedback might be about 3 minutes late, and by 3 minutes you might have missed certain words, or you might have missed certain phrases that you need to work in at that time to get that feedback and incorporate it.
If you found this video useful, you might want to watch this video in which I go more depth on clinical management. Click the video to watch it. Take care, everybody. Bye-bye.